Hi, good morning everyone. Firstly, just to thank you, Zan, for the introduction, and thanks very much to the organisers. It's really a pleasure to be here to speak to you all today, and to see the conference come together, so thank you very much for the invitation. My name's Sean, I'm working at the World Heart Federation, and I'm going to talk today about some work that we're doing, particularly with the aim of bringing together global data on cardiovascular disease. And really how we're trying to make that data more accessible and more usable to people who are working at the national level or the regional level on pushing for cardiovascular disease, non-communicable disease policies and the implementation of programs. So a couple of words about World Heart Federation just to start off. We're an umbrella organisation representing the global cardiovascular community. We're made up of national research societies, professional bodies, awareness-raising foundations, and we have three main aims. Firstly, to connect, lead and inspire this cardiovascular community. Secondly, translating science into policy to influence agencies and governments. This is a particularly important one that I'll refer to it several times throughout the presentation, that taking science, taking data and seeing how that can be best adapted and implemented is really a key aim of what we're doing and the initiatives that I'll present today. And thirdly, stimulating exchange of information with the goal of achieving heart health for all. We unite over 200 members from over 100 countries and are in official relations with the World Health Organization, advocating to bring cardiovascular disease to the forefront of the global health agenda. So to come back to this point of translating science into policy, obviously knowing which policies work, which policies are effective for preventing and managing cardiovascular diseases is essential for this, and have some resources displayed on the slide. You'll see second from the right, the NCD best buys, which some of the colleagues presenting yesterday mentioned. This is a great example of some policies that we know to be cost effective. I think the figure mentioned was a $7 return on investment for every dollar invested in these policies, so we know those policies are very effective for preventing non-communicable diseases. To the right of that we have the Heart Technical Package, also from World Health Organization, so that's more technical on how countries can better implement the detection, the prevention, the management of hypertension in their countries. Second from the left, we have the World Heart Federation roadmap for cholesterol. So we have a series of roadmaps that are slightly more broader. They really look across kind of the health system and provide a framework for action, both at the policy level. So, for example, for cholesterol, a lot of the best buys would be in there as an important measure for preventing dyslipidemia and ultimately cardiovascular disease. But also it looks at different levels, so health system factors, existence of guidelines, adherence to guidelines, public awareness, and these kind of things. So I'd also encourage you to take a look at those roadmaps which we have across several topics. So knowing which policies are effective is incredibly important, but so is reliable data. Data on the disease burden, leading risk factors, and on aspects of the health system related to cardiovascular disease within a country or a region, and this is essential for two reasons in particular. Firstly, demonstrating the need to act. We know that policymakers and people working to make decisions at national level, they have a lot of competing priorities. They have a lot of people coming to them saying that our issue is incredibly important, we need to act on this issue. So we need to have solid, good data that we can make the case that acting on non-communicable diseases, acting on cardiovascular diseases is essential for people and for the society. We also need good data to inform which policies and actions should be prioritized. Unfortunately, no country is able to implement all the actions, all the policies that we know to be effective for improving cardiovascular disease or NCD prevention and management. So we need to prioritize, and to do that we need to know the characteristics of the burden of cardiovascular disease, of NCDs, what are the leading risk factors driving that, what are the gaps in policies and health systems, and where we can best put our efforts, put our resources to respond to that in the most efficient way. We're looking in cardiovascular disease that there is actually the existence of good data and data initiatives, and I put a few on the screen here. We have from the European Society of Cardiology, an atlas of cardiology. We have the InterAspire study on the implementation of secondary preventive care post heart attack and stroke. have global burden of disease study, the NCD risk factor collaboration. So we have many good data initiatives in cardiovascular disease, but we have many gaps, of course, as well, and that's something I'll come to a little bit later on. What we saw a need for is to take all of this good data and to collate and curate it in a way that transforms data into actionable knowledge. So we have this good data out there. How do we make it available? How do we make it accessible and usable to people who are working, for example, at national level, in policy discourse, in other activities, to be able to look at the data, to understand what are the main drivers of cardiovascular disease in their setting, and to be able to start discussions around responding to that. And we've launched two main initiatives with this aim in mind. The first, the World Heart Observatory. This is an interactive data platform that's available through the World Heart Federation website. And we call it the first global data hub for cardiovascular disease. And what we're really trying to do with this is threefold. Informing evidence-based decision-making for health at the population level. So again, really taking the data, taking the science and presenting it in a way that can feed into discussions around decisions, policies and evidence-based decision-making. Secondly, also very important, building data capacity among national and regional organizations. As I mentioned before, we have several data gaps, need for data to be collected, and national and regional organizations are going to be very key in driving that. So we're using the platform to develop awareness and push for better data collection. Thirdly, creating a forum for research and debate for cardiovascular health among our members, among the cardiovascular community. We want people to be aware of the importance of data, aware of the data that's out there, and talking about how it can be improved and better used. So here's a snapshot of what it looks like. You see the data sources that we have in the observatory. We have global burden of disease study, data from WHO, the Global Health Observatory, the NCD risk factor collaboration, NCD countdown, and the World Heart Federation data from our own studies. And so here you see the diversity of sources, but also the diversity of type of data we have in here. We have data on the epidemiology, the burden of cardiovascular disease, on risk factor prevalence, on health systems and policy issues, on premature mortality. So you get the picture that we're really trying to bring in different kinds of data to give people a very clear picture of what's driving cardiovascular disease and what the status of cardiovascular disease is in their setting. The second main initiative is the World Heart Report. So we launched the first World Heart Report this year, and as Anna mentioned, we have some copies available, so please do take one and have a look. This is moving on to that curation element of the data that I mentioned. So it's taking much of the same data that we have available in the observatory, but starting to analyze it, starting to present some regional trends, some differences by sex, and looking at really kind of linking that to some initiatives, some resources that are out there, and encouraging advocates, people working in cardiovascular disease, to look into the data, to take it and include it in their national level initiatives. I think that the quote there that I've included on the slide, that's from the introduction, really captures this well. So the first ever World Heart Report is aimed at equipping policymakers and advocates around the world with the information needed to help reduce cardiovascular disease deaths and accelerate progress in cardiovascular health. So that really captures what we're trying to do with the report. To give you a bit more of an insight into what we've done and some of the key findings, both from the observatory, from the report globally and in Europe, I've used some figures here which I'll run through quite quickly. Firstly, the challenge. In Europe, 100 million people living with cardiovascular disease as of 2019, and you'll see this is a 25% increase as of 1990. So the numbers are going up, and this is a challenge in particular for health systems. We have more and more people living with cardiovascular disease, more people who need access to care and to treatment, and countries need to be aware of how to allow that access to treatment and how to pay for it. So the challenge. But some good news, progress in age-standardized death rates in Europe. You see that they're falling here, meaning that we're doing better. We're doing better in preventing and delaying cardiovascular disease deaths over time. And this figure shows the age-standardized mortality by global region. So again, some good news and some bad news on this slide. The good news is, as you see across all global regions, so each line represents a different global region. We have the key in the bottom. Generally falling trends across regions, so age-standardized mortality across all regions globally is falling. We're doing better globally at preventing, delaying deaths from cardiovascular disease. The bad news is, which maybe is a little difficult to see on the slide, but please do take a look in the report, is that the progress is not equal across regions. We have much quicker progress in the high-income country grouping, which is the light blue line across the bottom. You'll see it's descending quicker than many of the other regions, which means in wealthier countries, progress is going quicker. That's inequalities between regions. How about inequalities within regions? Here we see inequalities in age-standardized mortality within Europe. So as you see, much lower age-standardized mortality in Western Europe compared to Central and Eastern Europe. Similarly, in premature mortality, much higher rates in premature mortality in Central and Eastern Europe than in Western Europe. And I think one of the speakers yesterday mentioned the importance of this premature mortality being... Okay, I think that's good now. Premature mortality being deaths between the age of 30 and 70, so this is not only a tragedy in terms of loss of life, but also a significant impact on economies. It's people of working age who have been taken out of contributing to economic development, so something of a double burden for these countries who are suffering higher rates of premature mortality. Somewhat related to this, we also looked into some relationship between the expenditure, the investment in healthcare and age-standardized mortality. Sorry, I'll just wait a second. So we looked into some of the relationship between investment in healthcare and age-standardized mortality. Here on this graph, we're looking at the correlation between the current health expenditure from countries as a percentage of gross domestic product and the age-standardized CVD death rate in those countries, and we see a negative correlation between the two. So in general, countries who are investing less in healthcare as a percentage of their gross domestic product are having higher age-standardized rates of cardiovascular disease. As well as the trend, you'll see the colours, the colour of each country, of each point on that plot, represents the region that it's in, and unsurprisingly, a lot of the countries and regions made up of lower income countries have lower levels of investment in healthcare and higher levels of cardiovascular disease, age-standardized mortality. Particularly, you'll see the pink dots there clustered over towards the left of the graph is the sub-Saharan African region. Similarly, for out-of-pocket health expenditure, I think Alison from Non-Communicable Disease Alliance mentioned this yesterday about out-of-pocket healthcare expenditure being a very important issue for access to healthcare systems, to access to care. And we see that the higher the proportion of overall health expenditure that is covered by out-of-pocket, people paying out-of-pocket, the higher the age-standardized cardiovascular disease death rate in the countries, with again similar regional groupings as we saw on the last slide. And to give you an idea of the differences in investment in healthcare across regions, this is the proportion of countries per region spending at least 5% of their gross domestic product on healthcare. Unsurprisingly, the high-income region at the top, 97% of countries spending at least 5% of GDP on healthcare. This region, Central Europe, Eastern Europe and Central Asia, also high up, 85%, so good investment in healthcare in the region. At the other end of the scale, Sub-Saharan Africa, only 45%, less than half of countries reaching that 5% target. South Asia, no countries, but I should note that South Asia is in this grouping. This is grouping used by the Global Burden of Disease Study. There's only 5 countries in the South Asia grouping, but none of them reaching that 5% target. So we talked a bit about mortality, a bit about investment. I'm going to talk a little bit about risk factors as well. This is the attributable mortality from cardiovascular disease to different risk factors in 2021. So we had 20.5 million deaths estimated in 2021 from cardiovascular disease. Of those, over half of them are due to raised blood pressure due to hypertension. So it's the main risk factor for cardiovascular disease deaths. It's the main risk factor for non-communicable disease deaths in general. And we heard from some of the colleagues presenting yesterday also a known challenge in Kosovo. Both, I think the presenter from the World Bank mentioned the economic cost of hypertension, over 150 million euros in 2023. And challenges in guideline implementation, both due to awareness and to infrastructure, so an important challenge there that needs to be addressed both globally and here. Other factors, air pollution is the second highest contributor to cardiovascular disease deaths, 4.8 million deaths from cardiovascular disease due to air pollution in 2021. Elevated LDL cholesterol, high fasting plasma glucose, high body mass index, also important contributors, and two others that I heard coming out of the presentations with local data yesterday: tobacco use, low physical activity, important challenges in Kosovo, important challenges worldwide. And to look a little bit at the regional trends and differences in risk factors, coming back to that question of low physical activity, in Europe this is a particular challenge in men and women across the continent. So we see there the pocket of very deep red in Europe. There's low physical activity levels in both sexes. This chart is for women, but we see very similar patterns for men. Also in other high-income countries worldwide, so in Australia, Japan, North America, and also in the Middle East and North Africa, low physical activity level is particularly an important challenge for cardiovascular disease prevention. Sodium intake, we heard also about dietary risks yesterday, in particular related to low fruit and vegetable consumption. Sodium intake is another one, and this is linked in particular to hypertension. And in Central and Eastern Europe in particular, we have very high sodium intake. Again, you see the red pocket on the chart. Also in Western Pacific, some particularly important challenges related to sodium intake. Raised blood pressure, to come back to this one again, particularly in men in Central and Eastern Europe, we see compared to other regions very high levels of raised blood pressure in the region. So again, to reiterate the importance of that challenge. And non-HDL cholesterol in men as well, and particularly a challenge in Europe, some pockets of Southeast Asia and Central America as well. I'm going to skip over a few slides in the interest of time and move ahead to the policy index. So this is part of the report that we put together, really in an effort to map the policies related to cardiovascular disease that are in place in different countries and allow some comparison about what's been put in place, comparisons between different countries and regions, and start looking at some policy areas that could particularly be improved. So quick bit of background on what it is exactly. Quite a simple concept, but we wanted to analyse the level to which national governments have implemented 8 policies that are critical for cardiovascular disease health. It combines data on whether the following policies have been implemented in a country. So we looked at national tobacco control programmes, the existence of an action plan for cardiovascular disease, the existence of an operational unit within the Ministry of Health with responsibility for non-communicable diseases, existence of guidelines for the management of cardiovascular diseases, action plans for reduced physical inactivity, reduced unhealthy diet related to NCDs, and reducing the harmful use of alcohol, and the general availability of cardiovascular disease drugs in the public health sector. Simple calculation done for each policy that is implemented in a country. A score of 1 is assigned, and the index therefore ranges from 0, none of the policies implemented, all the way through to a possible score of 8 if all the policies are in place. To give you some insights into what we found, so the largest proportion of countries with a maximum score of 8 policies in place was in South Asia region, 80%, but again, caveat to that, 5 countries in the region, so a low number. Second region with the most number of countries having the full 8 policies in place, so it's this one, the Central Europe, Eastern Europe and Central Asia region, 68% of countries, and followed by the high-income region, 62% of countries having all 8 policies in place. Over 50% of countries in sub-Saharan Africa do not have general availability of cardiovascular disease drugs in the public sector. They don't have a national cardiovascular disease plan, and they don't have an NCD unit within the Ministry of Health. And globally, 64% of countries have at least 7 of the 8 policies in place. And I've included on the slide here to give you a picture, the heat map from the region from Central Europe, Eastern Europe and Central Asia, and there you see many of the countries with all 8 policies in place. We see some pockets there at the bottom, including some of the Balkan countries, where we have gaps, particularly around an action plan to reduce physical inactivity, action plan to reduce unhealthy diets related to cardiovascular diseases, and action plan to reduce harmful use of alcohol. So that gives us some ideas of where we can potentially focus discussions and efforts going forward. An important point to raise on this that came through some of the presentations yesterday is that this gives a snapshot, it gives us an idea of policies that exist. What it doesn't tell us is to what extent those policies are implemented, and also the quality of the content of the policies, of the guidelines, of the action plans that we're talking about. So it's really a first step that gives us some ideas of where to focus, where to explore further. But what we really need to understand at the country level is to look into the content of that information, to look into how well it's implemented and see if there's further action needed in those areas. So, some recommendations that we came up, we looked at all this data, and some key recommendations that came out of the report that I wanted to present to you today. The first one that I hope has come through loud and clear is that all stakeholders should continue efforts to improve data for cardiovascular diseases, relevant health policy indicators, and local implementation barriers and strategies. As I mentioned, we have good data for cardiovascular disease. We need a lot more. And just to give you an idea of the figure there on the slide, that's the availability of population data on heart failure internationally. You see very, very large areas of the globe where there is no population-based data on heart failure available. So we need a lot more data. Guided by the burden of disease and the predominant risk factors, and supported by technical and policy tools, countries should implement policies to combat cardiovascular diseases, and the implementation of these policies needs to be adequately resourced and monitored for progress. And frameworks that can help with this, the design of these policies and the assessment and the development of monitoring frameworks. There's a big push for the development of national cardiovascular disease plans in Europe, and we've had the first dedicated national cardiovascular disease plans recently launched in Spain and Poland, pushing for a lot more, and also plans at the EU level. These are very useful frameworks that drive further action specifically on cardiovascular diseases across the primary, secondary and tertiary level for the prevention and management. Again, need to be implemented with appropriate levels of investment, of course. And they should also, not something that I've touched upon, we talked about the inequalities globally, the inequalities within regions, but of course there are a lot of inequalities that exist within countries as well, and these really need to be considered when we're talking about policies, when we're talking about national cardiovascular disease plans, that the risk factors we're talking about, the disease burden, they vary significantly between people, between socioeconomic groups, between sex and genders, and we really need to be thinking about that when developing the plans, developing the policies to make sure that we're reaching the population as a whole. And contextually, national or even local implementation barriers are also key. We may know what policies work. We need to really think about how they need to be adapted to the local setting to make sure that they're actually taken up and they're actually used. So that was really the kind of summary of the report, the data initiatives we've got together, and some of the few key findings and recommendations that we've come out with. There's a lot more information on the observatory in the report, so please do look at those and explore them. I wanted to finish just with a word about World Heart Day, which is tomorrow, as was mentioned yesterday. I think we've talked about the importance of data, of evidence, and the importance of translating that into policy. And I think Global Awareness Days can play a very important role in this as a hook, as a date in the calendar where people are focused on an issue and we can bring them together for policy dialogues, for discussions around an issue. And I'm very happy that we're celebrating World Heart Day tomorrow, and thank you very much for the exciting activities that we've got planned. I mentioned a little bit about the theme of this year, which fits very well with some of the points that I've raised. It's no heart is the theme. So what we mean by that is knowledge around cardiovascular disease, understanding cardiovascular disease, and this is of course applicable at many different levels. We have understanding cardiovascular disease at the regional, at the national level, as I've been talking about, very important for policies, for planning, for program implementation, but also at the individual level, knowing the risk factors for cardiovascular disease, understanding your personal risk. All of these are critical elements, and in general across cardiovascular disease, that theme of knowledge is very important, be it that you're working at the national level in policy, be it that you're thinking about your own, your family, your community's cardiovascular disease. This is captured in some of the visuals from the campaign. So on the left we have comparison of cardiovascular disease deaths with shark attacks, really trying to get across the message that we need to be paying attention to cardiovascular disease. It's a huge burden and it's something that we need to understand and better act on. And then in the middle, about individual risk. Are you at risk of cardiovascular disease? Knowing your own risk, knowing your own numbers. And I think tomorrow on World Heart Day, I'd encourage everyone to think about, in the work that you're doing or in your own lives, what do you know about the cardiovascular disease risk in your community, in your close network, and what are you doing for that. So with that, I will end. Another big thank you. Thank you for the opportunity to speak. Thank you for everyone for listening.